A doctor with Swedish Hospital told me that while kids' immune systems are strong, some illnesses are already spreading ahead of schedule. The cold and flu season typically arrives in late fall and stretches into winter, but Dr. Elizabeth Meade, the director of Pediatric Quality and Safety with Swedish, says they've seen a spike in certain illnesses already this year.
We've seen lots of infections like RSV and other viruses that typically we really only see in the winter.
Meade says the spike aligns with certain COVID-19 restrictions lifting and people gathering together again. And while COVID-19 is top of mind in the classroom, another virus to be mindful of is RSV, also known as respiratory syncytial virus.
And so we've seen about a 6-fold increase from the end of June until now in terms of numbers of weekly positive RSV tests.
RSV acts as your typical cold for adults and older kids, but is much more dangerous for infants.
Because those young babies' airways are so small, they can often have difficulty breathing and end up needing some oxygen and other respiratory support in the hospital.
But are kids' immune systems less likely to fight off germs after so much time apart from others their age? Dr. Meade says not necessarily, but they may be more likely to catch illnesses quicker than in previous years.
Most kids don't get an infection and then get that same virus infection, within a month or so, but they might get it 6 or 12 months later, and that's totally normal. So I think what we're going to see and what we are seeing is that there's going to be a little bit of a shrinking of that time period in terms of when kids are getting all the things they haven't been exposed to for a long time.
Meade says the flu is still one of the most dangerous viruses for kids, and she encourages parents to get their children vaccinated. In Issaquah, Kayla Lafferty, King 5 News.